So my name is Wayne Waltzer. I arrived at Stony Brook in October of 1979, and currently I'm the professor and chairman of the Department of Urology. I grew up on Long Island in Nassau County, and I was out of state for many years with medical training. I was at the University of Pittsburgh and then the Mayo Clinic. And when I was finishing my fellowship in transplantation at the Mayo Clinic, I wrote a blind letter to a new medical center in Suffolk County called Stony Brook University. And I got a response that they were interested in looking for someone who had completed training in transplant surgery. And the rest is history. I was hired as a young person right out of training. And I've been here ever since, almost for 40 years. I saw it as a opportunity to be on the ground floor of a new institution, and I thought that I could grow and progress with the institution, and that really turned out to be true. So the first kidney transplant at Stony Brook was done in February of 1981. It was a living donor kidney transplant between a brother and a sister. Of course, it was, fantastically big news in those days, because it was a new university, a new program, and we had started fairly soon, delivering tertiary care services in Suffolk County. And the transplant program has grown from that to, in 2008, we hit the landmark of 1,000 kidney transplants, and in 2021, we're now over 2,000 kidney transplants at Stony Brook. So it's been a remarkable journey seeing the program from the inception to where we are now. Robotics is a new, great, really instrument in the armamentarium of surgery. And it really is a fantastic addition from the perspective of not only removing or taking out organs, but more importantly, robotics is most effective in reconstruction. One of the common operations we do is we do a partial nephrectomy, which means removing a usually cancerous mass from the kidney. So it's not only the removing of the mass, it's the ability to precisely reconstruct the kidney after the removal of the mass that robotics provides us the tools to do. Over the last several decades, I think students have changed. Every year they get brighter. Every year they get more facile with technology. I think teaching has changed dramatically. It's gone from giving lectures on overhead projectors or with slides to now virtual teaching via Zoom or Teams. The whole landscape has changed. In addition, since almost anything is viewable on the internet, i.e. YouTube, students can now watch many operations, procedures at home virtually before they even come to the classroom or come to the operating room. So they come much more prepared because of the whole revolution in information technology today. Mentoring students and residents is something that I think you get a lot of satisfaction out of, as well as hopefully imparting knowledge and experience to the individual that you're mentoring. I think it gives me pleasure to see some of these people, at a point in their life and career when I remember when I was at that point and looking for advice and direction. And I think the people who are being mentored, I believe they genuinely appreciate, faculty, not only myself, but faculty in general, taking the time to manifest an interest in them and show them a path that they think for them might be the right one or the correct one or one that, they may enjoy going forward. I think the institution should get more recognition from the public as to what it is and what it can really do. And I'd like to see, Stony Brook really progress into the upper echelons of highly regarded medical facilities. What made me want to stay at Stony Brook was the fact that I was getting to really, practice in the specialty, practice the type of medicine that I was, highly interested in, specifically both urology and kidney transplantation. And it really afforded me that opportunity to be here, to start on the ground floor with the institution, and of course, progress and grow the programs as they evolved. I've had a a totally enjoyable career here. I've enjoyed, many of the people that I've worked with through the years. I enjoy still my current practice of surgery, being engaged with residents, students, faculty. And, it's something that I really enjoy on a daily basis. I also met my wife here at Stony Brook, and then we had 4 children as a result of that. So Stony Brook has sort of engaged me both personally as well as professionally.